And welcome to all of you out there virtually who've signed up and now logged in tonight to hear me talk tonight about the truth about knee pain. We are going to share a lot of truth tonight. I'm going to share a lot of truth tonight. And these are truths that I've come by honestly through 25 years of time in my work as a physical therapist. So I look forward to sharing these things with you because even though they are common sense items, they can be really significant life-changing experiences. So I hope it is for you too. So I'm going to share my screen so you can see the slides that I'm going to use tonight. And there we go. Get it to go into presentation mode. My dog just now, good timing, Zeke, scratching at the window, wanting to come in. So we'll see if he scratches for the next 45 minutes or if he decides to sit down again. My name is Troy Vander, and I'm a doctor of physical therapy. I'm with a company called Kinetic Physical Therapy. Before COVID hit, we did a lot of these workshops live and in person, which are really fun to do because it's easy to interact with people when we can see each other face to face. Questions are a little bit easier in that live format, but we can do it this way too. So as I said just a little bit ago, if you have any questions at any time, click on that chat icon and you can just type your message in there. It will alert me with a little light that there's a question or a comment in there, and I'll do what I can to get to those. If I don't get to it during tonight's workshop, I will certainly respond to you later. I said you're going to get a recording sent to you via a link and an email afterwards, and that same email, it will have my contact information in there too. I'll share that with you as well at the end of tonight's workshop. So if you have future questions, please let me know. Why in the world would you want to ask me questions? Well, let me tell you a little bit about myself. As I said, I've been a physical therapist for 25 years. I'm a proud graduate of the University of Iowa's Physical Therapy Education program. That program is a really good program, consistently ranking in the top 2 or 3 in the nation. So I feel very honored and blessed to have gone through that and gotten really good preparation for my career as a physical therapist. But I will tell you, there is no substitute for experience. What you're going to learn tonight from me are things that I've just learned because I've seen so many people dealing with knee pain throughout the course of time. And when you do that, you begin to recognize that some of the things that you do are not particularly effective. And then you start to see trends developing as people day in and day out, year in and year out, continue to tell you their stories. And I've had a lot of opportunities to assess and evaluate. And I'm thankful to be able to share with you tonight what I've learned to be a lot of truths about how to manage and improve knee pain. And I'm going to kind of start with the lead here. The bottom line story is most of the things that people do to deal with musculoskeletal pain, including knee pain, are not particularly effective because they don't get to the root of the problem. They simply mask the problem. So tonight I'm going to kind of tell you a little bit about the problem with the way that we typically handle these things and give you an alternative solution that is good news in a lot of ways, because most often it's pretty simple, it's pretty easy, it's pretty common sense, and it gets to the root of the problem, which gives you a much better chance of having an impact that lasts and is not just temporary. My company, Kinetic Physical Therapy, I've been around, this company's been around since 1998. I've been with the company for 21 years. It's 7 clinics now. At the end of the year, we closed down one of our small clinics in Waukee and consolidated operations. Low back pain is the most common reason people come to see us. Knee issues and shoulder problems are probably tied for second. A lot of people, in fact, once upon a time, I did an analysis in our company over the course of 3 years. I think we did something like 20,000 visits with people dealing with knee pain. And so that's a lot of experience. Of course, that's not just me. I'm one of 22 physical therapists with Kinetic Edge. And though we're all unique and individual in our approach, we share something in common. At Kinetic Physical Therapy, we are committed to looking at things functionally. And so we have some unique training, what we call 3D maps. It's how to assess how the body functions in real world environments between gravity and the ground, because that's where we function. 2 feet on the ground, deal with gravitational forces and our body fighting the earth to stay upright against those gravitational forces. And so you'll learn some of those key things tonight as well. You might be wondering, is this workshop really for me? So let's just start there. If you are finding yourself slowly experiencing more and more discomfort, and therefore doing less and less, and as a result, concerned about becoming more dependent upon others because you're not doing what you used to be able to do, this is a perfect place to be. That is the story I hear so much. The issues that we're going to talk about tonight generally are gradual and progressive and slowly advance. But before you know it, it's turned into something much bigger than what it started. And as a result, people have tried so many different things to make it better, maybe get some temporary relief for a little bit of time, but it comes back, which is really challenging to deal with and makes you doubt yourself. I get lots of questions like, can we really make this go away? Or others that'll say, well, Judd, I'm desperate. Do I just need a surgery? What in the world? And then there's other people that are kind of thinking longer term and bigger. And this is true too. If we don't move very well, if I can't exercise because it hurts, what's that going to do to my overall health? And those are legitimate questions. If you're asking those, this workshop's perfect for you tonight. One of the truths we're going to talk about is that we are impacted by those closest to us, and we have impact on the ones who are closest to us too. And we know that's true in the human body as well, by the way. And again, I'll share some of the pearls right now. When you have knee pain, it's usually not a knee problem. That knee is experiencing stress because of something around it. One of its closest neighbors not doing its job well. That's what we're going to talk about in a little bit. But we also know that when we hurt, it's not easy for us to have a positive influence on our closest neighbors as well. And I think all of us want to be good friends, family members, neighbors to those that we love. And we're going to hopefully share information with you that allows you to do that a little bit better too. Many of you probably have already tried a variety of interventions and procedures to make this better. And the good news is what I'm going to talk about tonight are interventions that you can do that are very natural and simple and don't have side effects like a lot of the other things we do, medications, injections, surgeries, and those kind of things. Ultimately, most people that join me for this workshop say, I just want to move better. I just want to feel better. I want to function better. I want to experience less pain. So if those are your concerns, this workshop is for you. Now, there are some people this workshop is not intended for. We're going to talk about simple solutions, but most of the solutions that are going to be truly effective require just a little bit of effort. It's not hard stuff, but it takes time. If you're just looking for the quick fix, I wish I could share that with you. I wish there was a quick fix. And if you watch infomercials or go on the web, you're going to find there's a lot of people that will tell you there are quick fixes. I'm going to tell you there are not. Anything that gives you quick resolution of symptoms is probably just masking a deeper issue. It's not really getting to the root of the issue. And so if that's what you wanted, the quick fix, I'm not going to give it to you tonight. This workshop's not for you. Some people come in saying, I know I just need surgery. So, I'm not going to tell you that either. Now, some people do need surgery, and surgery can be effective, but I can clearly say that more people do surgeries than what are needed. And I think you'll understand that better tonight too. That's the crux of what we're going to talk about. Now, I want to stimulate a little bit of interaction here. So I would like you, if you would please, click on that chat button. I want you to answer a couple questions for me. First of all, is there something that you do that you know is going to make your knee hurt? What activity or posture position, what's the worst for your knee? Tell me what that is. And then a couple additional questions. How bad does the pain get on the 1 to 10 scale? Now, hear me out on this. 10 is the worst imaginable emergency room type pain. It can't get any worse than 10. How high does it get on that scale? And then how long have you been dealing with it? And you could simply say, days, weeks, months, or maybe years. The first question I'm asking you to answer, what contributes to your pain? That's really important for me to know because that will help me understand whether this information is going to be beneficial for you. The other two questions don't tell me whether the information is going to be beneficial for you, but it might tell me how long it's going to take for you to get relief for this thing. That which is more significantly painful, that's been around for a longer period of time, tends to require a little bit more time to make it better, but it can still change. One of my barbs says 4 to 10 years on and off. walking and standing. Okay, so we're going to talk about that in a little bit. Weight-bearing activities are usually the problem with knee-related issues. Usually when we sit down, it feels pretty good until we start to stand up again, of course. Let's see. Z says sitting on the floor, sitting a certain way, or sleeping on the left side. Okay, that's very interesting. Karen says stairs are the hardest, and it's about a year. Standing in one place too. So that's another weight-bearing activity. Z further gave me information 10 to 15 years on and off, and then squatting. That totally makes sense. Julie says the right knee hurts, about a 6 when she comes down steps in particular. Okay, that's an interesting comment, Julie. When we talk about types of knee pain, you might be interested in one of those that we're going to talk about here. So, my dog's dancing outside the window right now. Z says 5 to 6 out of 10 on the pain. Another person, Anita, says walking, steps, twisting, varies between a 4 and a 10, and for 26 years. So you've been counting, Anita. That's a little bit longer period of time. But again, if there is an activity that makes it worse, that's interesting that you share that with me. We're going to talk about that in a little bit. That tells me that we can probably do something about it. The higher pain levels, the longer period of time, that tells me how long it's going to take. But the reason I asked that question is because in a weird way, the pain that we experience when we do something in particular, it tells us that that pain is reproducible. It can be made worse by something in particular. And that's kind of good news because we know that if the pain is reproducible, it's also reducible. Okay, so there's a little word play there. What is reproducible with a specific activity is usually reduced when you reduce the stress related to that activity. Now, I've written down here in the bullet points the most common things that contribute to knee pain, the functional activities. You can see all these have one thing in common. They are weight-bearing related activities. That is generally the case. More chat things, working on the knee. So yeah, kneeling, that can be really difficult, puts a lot of pressure on those kneecaps. Climbing, walking for the last few years. Okay, steps, another one of my barbs says here tonight. So there you go, you can see it on there. We've got climbing stairs and ladders, walking and standing, squatting, housework and yard work. When you do yard work, sometimes you're kneeling down on your knees when you do those kind of things. But I want you to hear this loud and clear. If there's something that makes it worse, that's not necessarily bad news because we know then that this is a mechanical condition. And we'll talk about a little bit more about that. First thing I want to do though is tell you a little bit about the 2 most common types of trauma. When you hear the word trauma, what do you think? Well, if I had to guess, what you think when you hear the word trauma is usually what we would consider acute trauma, okay? Here's acute trauma. Sudden tissue damage, it comes on quickly, and then over time, as you can see on my little chart there, it slowly improves. And eventually, for most people, the acute trauma that caused the knee pain improves to the point where it goes below the symptom threshold and it no longer hurts again, okay? Now, if you have significant enough trauma, acute trauma, if the severity of the issue is significant enough, it could be chronic pain. That can happen. Acute traumas happens when you twist wrong and you tear a ligament or tear your cartilage, something like that. If you break a bone around the knee, that can cause knee pain. Those things are all acute traumas. That happens. Those are real issues. But most people that come to see us for issues related to knee pain don't necessarily experience an acute trauma. They're along this cumulative trauma path. And here's what cumulative trauma looks like. It's not one incident, it's a lot of little things adding up over time. And you can see for a while, it's getting worse, but we don't even know it yet because we're still below the symptom threshold. When we cross the symptom threshold, people will say, yeah, it hurts a little bit. It's not the same as it used to be, but it's not bad. It's not there all the time. So we keep doing the same things and eventually it gets worse and worse and worse. And that's where it becomes more significant, more painful, more common. You see those 2 buckets there? It's kind of a weird thing to have on this screen, isn't it? Well, the bucket analogy is an easy way to describe cumulative trauma, okay? Cumulative trauma says this. Actually, I'll hold on to that. When we do a little stuff and we do things in our bodies long enough, eventually the first thing we're going to notice as our bodies start to wear out is fatigue, okay? So fatigue is common. You know, I'm a physical therapist. I've been doing physical therapy for 25 years, half my life. It's not a very physically demanding job. But as time goes by, I realize that I have more fatigue than I used to, even with my relatively easy job. At the end of the week, I'm more tired and need more rest than I used to. I can tell I'm no longer a young buck anymore. I'm experiencing some evidence that my body is changing. Now, we usually don't do much about that because we know that's typical as we age, right? So if your knees start to feel a little bit tired, you're probably going to downplay to that too and say, you know what, that's typical. And more water fills our bucket because we keep doing the same thing. We keep applying stresses to the knee. We don't change anything, but more water fills that bucket. And what begins with fatigue can eventually turn into discomfort. What's discomfort? Well, it's worse than fatigue, but not quite pain. Usually people use word to describe discomfort like stiffness and soreness. People say, you know, it takes a little bit more for me to get going, or after I've done something on my feet for a longer period of time, I need more rest than I used to. Those kind of things are typical. And again, they're not significant enough. Most people would say, well, you know, I don't want to be a squeaky wheel. That's not that big of a deal. That's the way it goes, right? And so we just keep doing more and more water fills the bucket. And beyond that stiffness and soreness, eventually true pain can be experienced. And my guess is, if you're here tonight, you're not just experiencing some stiffness and soreness, you've had real pain. Because it's when people experience real pain that they start to say, hey, maybe this isn't going to get better. Maybe I need to do something about this. And maybe you've been dealing with pain for a while and you've tried a lot of different stuff. That's likely the case. The longer you've experienced it, the more stuff we try, okay? Now, when pain experiences here, the analogy shows this water filling the bucket. It's not quite overflowing. The next step when it starts to overflow is we got real damage occurring, true tissue injury, stuff that's going to take more time, more energy, more effort to overcome. So this is it. This is the bucket analogy. For me, I'm kind of a visual learner, and that bucket analogy makes a lot of sense. It's probably the path that most of you are on here too. When people have more water in their bucket, when that cumulative trauma arrow has risen high enough, they will tell me that it started as something that wasn't terribly frequent. The pain wasn't terribly intense. I had episodes, but they were of shorter duration. But the longer we experience, the more frequent, the more intense, the longer in duration these issues are. That's the cumulative trauma pathway. And you can see on my screen there, the train tracks, look in the distance there. Rounding the bend on the horizon, there's a train coming at you. Now, if we were truly on these tracks and the train was coming, you'd start to hear the whistle blowing. You might feel those rails underneath your feet start to vibrate just a little bit. There's evidence that that something's about to happen, warning you to get off that path, okay? I want to be that for you tonight. And if you don't, here's the problem. If you experience more pain, we move less. And that doesn't just impact our knee health, that impacts our overall health. And so what I'm talking about tonight is really important because it helps your knees feel and function better. But it also, if done right and gets to the root of the problem, allows you to move better, to move more often, which means your overall general health is improved too. So in America, Americans spend 86% of their healthcare dollars on 6 things. Okay, number one, easily number one, musculoskeletal issues, of which knee pain is one of those, okay? Number 2 is heart disease related issues. Number 4, I'm skipping number 3. Number 4 is diabetes, 5 is obesity, and 6 is depression. The one I skipped, number 3, is cancers, okay? But I'm mentioning musculoskeletal issues, heart disease, diabetes, obesity, and depression because all of those are impacted, for better or worse, by movement. The better we move, the less likely we are to have those other issues. The worse or less often we move, the more likely we are to have musculoskeletal issues, heart disease, diabetes, obesity, and depression-related issues. And so what I'm encouraging you to do is to stop treating the pain and to treat the problem, to get to the root of the problem, because it's going to have a major impact on your overall health, which is really, really much more significant than just some musculoskeletal pain. The reality is people don't work that way, right? I'm the same way. I'm sitting in my house here. To that direction is the old part of the house. It was built in 1915. We're in the new part that was built about 25 years ago. Above all of it was a roof that when we moved in was not in good condition. The shingles needed replacing. My insurance company said, we'll insure you for everything except those shingles. When you replace them, let me know and we'll put them on your plan. And I didn't do anything about it because guess what? I didn't see any problems. There wasn't any leaking. I ignored it because that's what people do with problems that don't seem like that big of a deal, right? Now, I'm happy to report I spent quite a bit of money this past summer and got it fixed. But if I kept ignoring that problem, it was going to lead to bigger issues that would cost me a lot more money if I let it get to the point of worse problems. And so you were probably there once upon a time. Eventually, when the issue becomes significant enough, we do something about it. But most often, what we're going to do when we finally decide we can ignore it no longer are things that don't get to the root of the problem. They simply alter the problem. In fact, you go online and you search for knee pain solutions, and you're going to find there is a multi-million, billion-dollar industry of products that promise things that they can't deliver. Spend this money, take this pill, put on this cream, wear these magnets, put on this brace, and your life's going to be changed. All of those issues, all of those solutions are not truly solutions because they don't get to the root of the problem. They simply mask it. So tonight is all about getting to the root of the problem. I want you to commit to solving it because not only is it more effective, but it's longer lasting. So that's what we're going to talk about. And we can't talk about it without understanding this key point. In the Western world, and in America in particular, we are taught to look at things very constructively, but in a narrow way, okay? In the medical world, we seek medical solutions. And if it hurts, we got a pill for that. We got an injection for that. We got a surgery for that. But we don't understand very well that that hurt, that pain, that thing that requires alteration is that way for a reason. And it's not a medical situation. It is a mechanical situation. So if you try to treat a mechanical problem with a medical solution, you are not going to get a real solution, okay? You cannot successfully manage a mechanical problem with a chemistry treatment. Those pills might make you feel better, but it just alters the chemistry. It does not change the mechanics of that joint. We need to take the mechanical stress off that joint. And so I want you to hear this loud and clear. It's a movement-based problem that requires a movement-based solution. It can't get better, not long-term, with a medical solution, a chemistry treatment. It just is not going to work that way. I also want you to understand this. We're not going to get deep in the weeds with this, but I want you to understand that when tissues are injured, we go through a natural healing process that has 4 phases. Okay, I want you to look at the name of phase 2. You see that? Inflammation. Now, for a moment, if you would, think about this. When you think you have an inflamed joint, an inflamed tissue, what is your immediate reaction to that? Think about that. If you were told, well, that thing's inflamed, I need to do this. Okay, we understand in America, we have our rapid disposal, easy access to all these anti-inflammatories, some of which are over the counter and some of which are prescription anti-inflammatories. And that makes sense, right? Inflammation makes me hurt. Get rid of the inflammation makes me feel better. But here's the deal. Inflammation is a normal, natural part of the wound healing process. Inflammation is what causes the formation at the early stages. The infancy of this prepares for the matrix of blood vessels that will inundate the healed tissue, the healing tissue. And if we go from inflammation to proliferation and eventually to maturation, that wound gets pulled closed, the vasculature matures, and that tissue has the ability to get the nutrition that it needs. Because that blood flow through the vascularization is what carries all the nutrients to that tissue. So let's rewind a little bit again. If we get rid of inflammation, we are stopping this developing vasculature growth, and that tissue cannot proliferate and mature and have well-supplied means of getting blood and therefore nutrition to that tissue, okay? So I'll tell you this. Anti-inflammatories temporarily make us feel good, but they can be fool's gold. Okay, one of my favorite authors, he wrote things many moons ago, C.S. Lewis. In an essay that he wrote around the time of World War II, called Miracles, he says this: the magic is not in the medicine, but it's in your body. It's in the patient's body. What true effective treatment does is to stimulate nature's functions or to remove hindrances. So what he's saying is, if we're really going to help the body heal, we either need to help the body do what it was designed to do, or we need to get rid of things that are preventing the body from doing what it was designed to do. Okay? So an anti-inflammatory doesn't help the body do what it's supposed to do. It's supposed to get inflammation because that helps the healing process along. It doesn't remove a hindrance. It actually adds a hindrance because it stops a natural part of the healing process. And so I'm going to encourage you not to get entangled in the easy web of anti-inflammatory treatment of pain. It can make you feel better, but you're going to be left with tissues that can't get the nutrients that they need, and therefore that tissue is going to be a pathological tissue that's more easily irritated as time goes by. Make sense? All right, before I tell you about the types of knee pain, I want you to tell you a little story about a lady named Vicky. That's a fake name. She was a client of mine several years ago, 61-year-old lady who was very active, and walking was therapeutic for her. She did it with her friends, in some cases more than once a day, around a reservoir that was close to her home. She came and saw me after doing a lot of other medical treatment because she had this deep ache on the outside, deep within the lateral aspect of her knee. And she told me, it feels pretty good when I don't walk, but I want to walk. And I know it's not good for me not to walk. And she had seen doctors and gotten medications and gotten diagnostic tests and had an injection, and had finally been told by an orthopedic specialist, well, we're probably going to have to do a total knee replacement. That surgery is really what you need, because they could see evidence on the MRI of some major joint changes. Okay, here's the deal. She didn't want to do that. She wanted to do what she could to continue to operate without the need for those things. And she was desperate enough to come talk to me and to listen to me. And I'm glad that she did, because we did some simple assessments and we found that her knee was suffering for sure. There was evidence of that, ample evidence of that, but it wasn't her knee's fault. It was her hip's fault. And no one in the past had seen that her hip was doing things that contributed to increased mechanical stress at the knee. And as a result, if she had had that knee surgery, she would not have improved that mechanical problem, which would have likely led to future problems even after the knee had been replaced. Okay. And we worked with her for a few weeks, and at the end, she was pleased as punch. She was 95% better. She was walking again. And last I saw her about 6 months ago, was still doing really well. And that's because she found and fixed the root of the problem, which is really simple. We're going to talk about what those root problems are after we talk about the most common types of knee pain. And then eventually we'll talk about what successful treatment looks like. Okay. First, let me show you this knee. This is a basic knee. This is a right knee facing you. All the muscles and tendons and ligaments have been removed. We can see the major bone of the upper leg, the biggest bone, called the femur. That meets with this lower leg bone, the bigger of the two, called the tibia. That tibia and femur together create what we call the knee joint. This little bone on the outside of the lower leg is called the fibula. You've probably heard of that before. Some people who break their lower leg break one of the bones or both of the bones. And then on the front here is this kneecap, the official name being the patella. This is a hinge joint that is made to bend and flex and extend. Flexion and extension is what that's called. And you can see in the sagittal plane, flexion and extension has 140 degrees of motion. That's what hinge joints do. They bend and extend quite well, okay? But I want you to also understand that every joint in the body moves three-dimensionally, okay? So it will flex and extend, okay? There's a little bit of side bending, left and right. There's a little bit of rotation as well. It's not designed to do as much of that stuff, but it needs to do some of that stuff. And so all of those joint structures and the stuff supporting the knee joint is equipped to move three-dimensionally. The problems occur when a tissue is taxed beyond its design, okay? We can do something that is not great for the knee relative to its intended design. And initially that's not a problem, but we do it often enough. We experience enough repeated stress over time and changes progressively occur. That's cumulative trauma. that thing that I showed you on the chart a little bit ago. And those progressive traumas lead to frictions and or tensions that bring about inflammation, which make you painful, which might make you tempted to take an anti-inflammatory to get rid of that pain. I want you to understand the design of that knee, because everything that we're going to talk about is due to us requiring our knee to do things it really wasn't designed to do. Now, when we talk about the most common types of knee pain, I want you to understand I'm giving you a demonstration or a description, but I'm not talking about the causes yet. The same cause can cause all kinds of different knee pain types, but I do think it's important to understand the most common types. We're going to talk about arthritis. We're going to talk about meniscal injury, and we're going to talk about patellofemoral pain. Okay, first, arthritis or osteoarthritis. This literally means osteo means bone, arth means joint, and itis means inflammation. So it's inflammation of the bones that make up a joint. Okay, but there are other words we use to describe arthritis. Joint space narrowing. There's often associated with this bone spurs. Look at this knee x-ray right here. This is the left knee, I think, facing away from us. You can see that fibula on the outside of the lower leg. This would be the lateral knee joint line, quite a bit of space there. The medial knee joint line is much narrower, right? So we can look at that x-ray, you can see that the joint is in closer proximity than what it naturally should be, and we know there's some arthritic changes happening there. In fact, some people might be told after seeing that they probably got some bone on bone going there. We'll talk about that in a little bit. That does cause a wear and tear that can wear away some of the cartilage between there. And by the way, that cartilage there, these are your meniscal tissues. And then you've got cartilage that lines the bones. There are two different kinds of cartilage. We'll talk about that in just a little bit. But I want you to understand that all cartilage is aneural, meaning it doesn't have nerves, which means it can't experience pain. So if you've been told you have arthritis here and your cartilage is wearing away, that's why you hurt, I'm going to say, well, probably not, because that cartilage doesn't have nerves. It's not painful. It's a sign of the problem, but it in and of itself is not the problem. So getting rid of that cartilage issue may not be very effective at all. In fact, there's lots of evidence. We'll talk about that. Surgeries to remove cartilage in the knee aren't very successful whatsoever. People that experience osteoarthritis will experience a deeper knee ache, and that's what Vicky was experiencing, deep on the lateral portion of her knee. But I want you to know this. Most people who have these kind of arthritic changes don't know it because they don't experience pain, and therefore they haven't had an x-ray or an MRI. When people start to experience pain, that's when they get these pictures. And then we see that there's evidence of some changes. And then we align those two and say, well, look at that. That's not normal. That must be why you hurt. But that's not true, because more people have this and don't hurt than those that have it and do hurt. It's a sign that there is some mechanical stress happening there, but it's also evidence that you need to remove those mechanical stressors to feel better. Now, this is an artist's rendering of what it was, a pristine knee on the left, and on the right, one that's experiencing more arthritic changes. You can see loss of the cartilage, some spurring of the bone, osteophytes, reduced joint space. There aren't many joints that look this good on the left. Those would be adolescents and earlier. There aren't many that look this bad on the right. This is certainly a really, really, dramatic illustration of this breakdown. Yours wouldn't look as bad. I told you that a lot of people have knee issues that they don't know about because they don't hurt. Most people that have them do not hurt. This isn't just a knee issue either. This is true at the shoulder, at the ankles, at the hips, at the back, at the neck. All of these things are much more common in asymptomatic people, people that don't experience symptoms. And so I want you to understand this should be a source of hope for you. I want you to understand that the presence of a pathology is not necessarily correlated with pain. Certainly is not necessarily the cause of the pain. And so don't try to fix pain issues by repairing pathologies or fixing pathologies. Fix the movement, because remember, it's a mechanical issue. Hold on just a second. I'm going to let my dog in. All right, sorry about that. Remember I said earlier that many people are told they have bone on bone. If you've been told that, you can raise your hand here. A lot of people hear that. But I want you to understand that that's very unlikely to be true. It's probably an overstatement at best. It's kind of a myth. If you truly have bone on bone, there would be a mechanical block and you wouldn't be able to move. That's not the case. Also, if you did have bone on bone, it wouldn't take much to create a fracture there, because it takes about 800 pounds of force to break the bone. And if you weigh 200 pounds, every time you take a step, you have close to 800 pounds on that knee. Actually, there's some research that shows it's 4 times your body weight at the knee every time you take a step. So just think, if you try to jog just a little bit, those forces go up, and fractures due to bone on bone stuff are exceptionally rare. They do not occur. So if you've been told you have bone on bone, it's probably just a little bit of an overstatement. It's clear you got a loss of joint space because wear and tear on some of those cartilage tissues, which, by the way, as you know now, they're aneural. That's not going to cause the pain. But it does create an inflammatory response within the knee, and that can be uncomfortable. That can all be solved, however, by fixing the mechanical issues, which we'll talk about in a little bit. What about meniscus injuries? So remember here, this is a right knee. The patella has been flipped up so you can see the lateral meniscus and the medial meniscus. And then you have what we call articular cartilage right on that bone. When you have a meniscus injury, it can look there's different types of tears that can occur in there. It's called a longitudinal tear because it's following the contour, the fibers of that tissue. And in this case, they've actually done a repair process to that thing. If you've ever had that done, that's usually done in younger people, hoping to maintain the integrity of that cartilage. For those people that have that surgery, they will be non-weight bearing for at least 6 weeks and on crutches, no weight on that thing. Most people that have arthroscopic surgeries just have a removal of that tissue instead of a repair of that tissue. And people bear weight very quickly after those particular procedures. But remember, once again, cartilage doesn't have nerves, so it's not the source of pain. But especially amongst younger people, there can be significant enough tears that get locked into there and cause the knee to lock in place. If that occurs, there can be some value in trying to repair that or cut some of that stuff out. But again, I would tell you, by and large, particularly amongst middle-aged to older-aged people, these surgeries are probably done a little too often without considering the root of the problem, which we'll talk about in a little bit. Some studies about the relative effectiveness or lack thereof of injuries and surgical repairs of that issue. The British Medical Journal in 2018 looked at all the studies that have been done on arthroscopic surgeries for the knee and found that we can see no real difference between surgical and non-surgical intervention. So at least in Britain, they're not recommending these surgeries anymore. They're really rare. If you're 60 years of age or older, it's likely that you have some degree of meniscus injury. Most of those people don't have pain. There was actually a study done several years ago where they had people that had known arthritic changes and meniscus-related injuries with that. And half of them they put under and actually did a surgery. Half of them they put under and they introduced a scope but didn't do any surgery. And the outcomes were no different amongst those that had the true surgery and those that had the sham surgery. And so my encouragement is think long and hard before you have those surgeries. And even if you have done those surgeries and found out, doggone, that didn't help me, it doesn't mean you're a lost cause. What we're going to talk about is going to be really, really important for you today here too. The third type I want to talk about is patellofemoral pain. Kneecap pain really is what we're talking about here. Why in the world do I got a train on here? Well, for years I've called the kneecap a dumb bone because it's not like a car. A car can go wherever it wants to. A train can only go where the tracks tell it to go. And your kneecap is like a train. It's going to go where the tracks tell it to go. It will move through the knee, over the knee, depending upon how the tracks are aligned. And lots of times you get undersurface issues on the kneecap because it's rubbing. There's a friction and a wear and tear process that occurs as a result of that friction on the undersurface of that knee. That's very hard to see on diagnostic testing. It's really common. These type of people will have problems going up and down steps, particularly down steps or down hills. Step ladder climbing, stair climbing, those kind of things can be an issue as well, particularly if you feel that pain towards the front of the knee, not deep in the knee. Okay, it's usually a dull ache towards the front of the knee. And it's almost always due to poor coordination and communication between your hips, knees, and foot. And that leads to this friction issue that brings about inflammation and therefore pain. As a result, taking an anti-inflammatory can feel better, but if you haven't gotten rid of that mechanical stress, it's going to come back. All right, we've talked about arthritis, we've talked about meniscus injuries, and we've talked about kneecap-related problems, but let's talk about more important stuff about the true cause of these things. Remember a little bit ago I said every body part, every joint is made to move three-dimensionally. And there has to be a balance between mobility and stability at every joint as well. And being balanced between mobility and stability is ideal and better for both function and long-term pain control. We have problems when we get out of the center with that. If we skew towards too much mobility and not enough stability, that's a problem. If we skew towards too much stability and not enough mobility, that's a problem too. So I've created or I've used this weird word called most stability, the combination between mobility and stability. I talk a lot about Goldilocks. Remember that story, that fairy tale? Not too hard, not too soft, not too hot, not too cold. Same with the body, not too stable, not too mobile. Something in the middle. Goldilocks is really a good story to help us understand that. But it's not just your knee, it's the things around your knee that if there's dysfunction, the hip above or the ankle and foot below can lead to compensations that require the knee to do more than it should or to move in ways it wasn't designed to move, which for a while goes fine, but with enough repetition leads to this cumulative mechanical wear and tear, trauma-related process. So you will not be surprised to hear me say that the primary causes of knee issues are the closest neighbor just above the knee at the hip, just below the knee at the ankle and foot. And then actually the third one, believe it or not, is your thoracic spine, the mid to upper back region. Let's talk about all three of those. Remember, your hip too is made to be moving three-dimensionally and have a balance between mobility and stability. And we have problems. Dysfunction exists when the hip doesn't move enough, it's too stiff, or when the hip moves too much, it's not strong enough. There's a weakness-related issue. So this bottom one, an overly mobile hip, because of weakness around the hip, that was Vicky's issue. Every time she landed, the knee fell inward because the hip wasn't supporting it well, which forced the knee inward, which puts mechanical stress, compressive forces, deep within the lateral aspect of the knee, which caused a wear and tear process. Now, we could clean that out with a surgery. I don't do that, but there are those that do. But if we haven't fixed the hip dysfunction, she's going to go back and she's going to have those same forces, and there's going to be consequences to that in the future. And so some people have an overly mobile hip, and we need to work on strength and stability to keep the knee aligned appropriately so that we don't have lateral knee compressive forces or a laterally tracking kneecap that's going to create friction at the patellofemoral joint. And then there are other people that don't move well enough the hip. The hip gets stiff, particularly with internal rotation. I see that often. Another area that can create stiffness-related issues are tight muscles. So think about the positions that we're in today's generation. I'm sitting here at a desk by a computer. Lots of people sit at computers anymore, or they're sitting in vehicles driving long distances where we're in a hip flexed position for extended periods of time. All of these hip flexor muscles that start at the lower back and the pelvis and travel to the front of the femur, the upper part just below the hip, are in shortened positions when we're in that 90-degree hip position. And those muscles can become the positions we put them in. So as soon as we stand up, that puts tension on those muscles, which extends the low back, can lead to lower back pain problems, or forces the knee to compensate with additional movement because of what the hips are incapable of doing. So I would tell you, if you had both knee issues and low back issues, hips are very likely to be one of your core issues. And if you have sought treatment and solutions and have never ever looked at what your hips do, you're probably missing a critical component to health. I just want to show here that if your knees bow too much, that leads to mechanical stress on the inside of the knee. If your knees knock too much, which is what happened on one particular knee with Vicky, then you're going to get pressure on the lateral aspect of that knee. So these are, again, dramatic examples of that. Sometimes it's a lot more subtle, But even a subtle change in forces at that knee joint because of what limitations or dysfunctions occur at the hip, when repeated often enough, leads to the slow, gradual, progressive, cumulative issue that finally gets to the point where people say, it's not as bad as it could be, but eventually does because the stress continues to build. The ankle and foot is the neighbor below the knee that needs to be assessed as well. A foot or heel that's too stiff, the knee will compensate by moving to make up for the lost motion at the heel. What's probably a little bit more common is an overly mobile heel, flat feet where the heel doesn't stay stable enough, and that causes extra motion that accumulates in other joints. That can be bad for the ankle and foot, that can be bad for the knee, that can be bad for the hip, that can be bad for the low back. If you've had lots of those issues, we certainly need to look at the ankle and foot and make sure there's ways of stabilizing there to make sure everything above the kinetic chain, above that ankle, is doing what it needs to be able to do and can stay balanced between mobility and stability. Okay. A little bit ago, I talked about issues not changing the stress at the knee, but that can be due to different positions of the foot when we land and bear weight on those feet too. What about this thoracic spine region? Okay. Well, if you can, I want you to stand for me. Okay, when you stand, I want you to put your mind's eye, don't look at it, but put your mind's eye on your right arch, the arch of your right foot. Okay, plant both feet 50-50. While you do that, rotate your spine as far to the right as you can. Okay, and then as far to the left as you can. I want you to think about what's happening when you rotate all the way one direction to the other at that right arch. And if you feel, you'll probably feel the arch drop and then the arch raise depending upon what direction you're going. The reason I have you do that is because I want you to understand that there's a correlation between all these parts. And that movement, when we get to the point where we're at the end of that motion at the thoracic spine, then the motion starts to happen elsewhere, all the way down to the lower foot. Now, the thoracic spine is supported by a rib cage. Those ribs connect to the thoracic spine. It's not made to move as much as other parts of the spine move, but it is supposed to rotate nicely. Okay, lots of people get stuck in a flex spine. They can't rotate very well. And now everything down the chain, including your knees, have to compensate for that lack of rotation of the thoracic spine, which can lead to cumulative stresses that eventually create something beyond just a little stiffness and soreness, eventual pain and tissue damage related issues. So again, your thoracic spine needs a balance between mobility and stability. The bottom line is this, folks: if you've had knee issues and you've sought help, and that help is focused on getting rid of the pain with medications, injections, surgeries, or knee exercises that are only knee focused, but we haven't looked at the hip above the knee, the thoracic spine a little bit above the hips, and the ankle and foot, the closest neighbor below, you probably have missed something that is contributing to additional mechanical stresses on the knee that contribute to this progressive, gradual, cumulative traumatic issue that needs attention. And remember, it's not a medical problem. It's a mechanical, movement-related issue that needs a movement-based solution. And so finally, I just want to say very simply that if you want to get rid of the problem once and for all, you got to aim at the primary root cause or root causes. Okay. Now, unfortunately, the most common treatments are medications, injections, and surgeries. That doesn't matter if it's a knee problem, an ankle problem, a back problem. Those are the most common interventions, none of which get to the root of the problem. Sometimes with knees, we're encouraged to use orthotics or braces or something like that. Even those are not true solutions. They're just trying to take the stress off that tissue or get rid of the inflammatory related issues, the damage to that issue. If it has not solved the movement issue at the areas surrounding the knee, it's not going to be effective. It's going to be money in most cases that is going to have limited lifespan. Okay, we found that knee injections don't improve quality of life. In fact, they're the more knee injections you have, the more cartilage you lose, and the more likely you're going to have some kind of a surgical intervention. That's what the research shows. Arthroscopic surgeries are not effective. Remember, the British Journal of Medicine says we're not even going to recommend them anymore. We do a lot of rehab for people that have total knee replacements, knee joint replacements, and those are oftentimes necessary because that joint is just way too worn out. But unfortunately, 20% of people continue to have pain after that total knee replacement. If you've had a total knee replacement and you still have pain, I would encourage you to look at the ankle, the hip, and the thoracic spine, because there's still probably some mechanical stress, even impacting the artificial joint in that case as well. Okay. My encouragement is stop ignoring, stop altering, and address that root cause. And if you're going to really do that, you need to find out what your root cause or root causes are. It needs to be a very individualized treatment, okay? And we can't just look at the knee, because your knee is a part of a dynamic system that's impacted by what's happening when the gravity pushes us to the ground, okay? The knee needs to act in concert with and symphony with the ankle, the hip, the thoracic spine, and all those parts that are impacted by gravitational forces, and fight against those gravitational forces into the earth. Okay, so we got to look beyond the knee itself. We are allowed to see multiple people at the same time. Insurances allow that, believe it or not, but don't do it. It needs to be one-on-one. It needs to be very specific to your needs. And the process should be educational and empowering. What I mean by that is, you can't just do one or two exercises and expect it to get better, because as your body changes, the needs change. And so you'll be empowered to do the right thing at the right time to get the right response to move to the next level with this. And then finally, you can't stay on a table or on a machine to get better. Eventually, you need to get up on your feet, and you need to teach the knee how to cooperate well with all the other parts. And that requires combine movement with exercise and functional movement patterns. If we do that, instead of this thing slowly climbing in a cumulative manner, we're getting it below that symptom threshold again. That doesn't make the tissue damage go away. If you take the mechanical stress off that tissue and do well, and 6 months later you take another picture with an X-ray or an MRI, it's not going to look much different. But the tissue's healthier because we're taking stress off that thing, so we're below that symptom threshold. That's what successful treatment does. It reduces the mechanical stress, so we function well with the fewer symptoms. All right, so I've hit you with a fire hose here tonight, and I think I've probably told you some things that make some common sense, right? But we still have problems. Number one, there's no way you can remember all this stuff. It's too much. Number two is you still don't know what your specific problem is or problems are. And even though it's really popular to say knowledge is power, I'm here to tell you it's not. Knowledge is not effective at all unless you can put it into practice. Implementation is where the power is. And so I want to encourage you to take one step further tonight. As a reward for spending a little time with me tonight, I'm going to offer you something special. I want you to go through this thing called a knee pain relief consultation. And here's what this is. Now, hear me out, because I know you're saying, okay, where's the catch? Well, it's really simple. By spending a little time with our knee pain experts, and I'm talking 20 minutes, they're going to ask some good questions. They're going to do some simple assessments, probably of your ankle and your hip and your thoracic spine, among other things. And in short time, they'll be able to say, here's probably the type of pain you're experiencing, and we don't need an X-ray or an MRI to prove that. More importantly, they'll be able to say, here are the issues that are contributing to mechanical stress at the knee. These are the true problems that need to get solved. And then finally, they'll be able to say, here's what the process of making it better would look like. Now, remember, it's not a snap your fingers. There's a process, but it's a simple process that gets to the root of the problem that yields results. And so if you choose at that time to go through with that, more power to you, but it's totally up to you at that time. Now, what's the value of this? Well, first of all, there are lots of benefits, because by getting this information, you can say, okay, I can stop wasting money on things that aren't going to fix it, and we can get to the root of the problem, which hopefully solves all those issues that we said you're probably dealing with. The value of this time in the marketplace would be $150. Here's the deal. I'm not going to make you pay a thing. This is absolutely free. So again, no catch. We want you to have that information, because that information can lead to implementation if you choose. And by implementing that information, if you choose to do that, that is where the power is with this, okay? Now, I'm going to give you a guarantee too. Since I'm not charging you for the time, I can't give you a money back guarantee, but I can say this. If you go through this and you say, well, that was a waste of my time, just tell us, And we will give $150, the value of that time, to a charity of your choice. Okay. We love supporting local charities, and we do as much of that as we possibly can. But I'm happy to say in this particular situation with this guarantee, we have never had anyone take us up on this, because it is not a waste of time. It's really valuable to understand how to get to the root of the problem by becoming aware of what your real true root issues are with that. And at the very least, you'll have a written summary that we'll provide you that day that has that bullet pointed out for you. The primary culprits have caused these problems in you. Here are the root causes with that. And that's yours to keep no matter what, which is good information to have. So if you want to take me up on this offer, it's really simple. You can either pull out your phone camera and go on that QR code, and it'll give you a link you can log on. Probably the simplest thing to do, though, is click on that chat box and say, I'm in. I want to have that free 20-minute natural knee pain relief consultation with one of those knee experts. So click on that chat button. Here's the deal. We have clinics in 7 locations. So we can do this in Ames. We can do this in Des Moines. We can do this in Newton or Colfax. We can do it in Pella, Oskaloosa, or Centerville. So if you're in, I already see a few of you chatting right now. So if you're in, tell me which clinic works best for you. Again, Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, or Centerville. Now, if we're not close to you in any of those locations, we can do it online too. So just give us the online thing and we'll get you set up for that too. Okay. Now I promised I'd give you my personal information, so you can write this down. It'll be in the link that I give you when you get the email later tonight too. But that 641-780-6330 number, that's my phone right here. I want to be a resource for you, no matter what. My email address, if you reply to any of the emails you've gotten, that will eventually get to me too. So you can use that too. That's an easy way to get back to me. All right. So let me stop sharing here and I'm going to read the chats. We got a few chats coming through. Okay, Karen, we're going to get you in Newton. Excellent. Julie, Ames. V, Impella, very good. And Kurt, going to get you in Impella too. Anita, oh, you're already on the schedule. Friday Impella, can they do during the phone? Here's the deal. If you're already scheduled for an appointment, Anita, that same assessment will be incorporated into the evaluation that you're going to get that day. So you'll just know more than most clients coming in for that first visit. Make sure, I don't know who you're seeing in Palo. We got lots of good therapists there. It's probably Melissa or Steven or Sarah, most likely. They know all this information and they apply it on a regular basis already. So that's great. Kylie and Ames to help with knee pain. She's great. Yeah, Barb, she is awesome. And she's probably teaching a little bit about this whole Goldilocks process too. She might not use Goldilocks analogy like I do, but I'm sure she's using that concept nonetheless. Yes, Anita, Sarah, she's awesome. Glad you're seeing her. So as I said earlier, you're going to get an email later. It'll have a link to this video that you can watch. There will be a link on there if you want to sign up. If you've already set it here, you don't need to do this. We'll contact you and we'll find a time that works really well for you. But there is a link on there that'll get you to that spot on our website where you can say, yeah, I want a screen and here's where I want it. You can do it that way too if you haven't committed yet right now. And then again, that link with the video, if you know people that are dealing with knee pain, here's the problem. The research shows that 10% of the people that can benefit from this information ever hear it. Most people don't hear it, which means there's a whole lot of people out there seeking solutions that are not going to get to the root of the problem. And I've been around for 25 years. I used to be a little bit more conscientious about being bold and stating this, but I'm sick and tired of people wasting so much money, having their hopes dashed so many times because they think they have the solution and doggone it, they do it and it's still problematic. But I also want you to understand this. You're not going to do this and feel like a 20-year-old again. That's not the way the body works. But I can guarantee you this, if you take the mechanical stress off of that tissue, if you take the mechanical stress off that knee, you will have less frequent pain, you will have less intense pain, you will have shorter duration episodes, you will move better, and you will move more often. Those are things we can absolutely guarantee. We can't guarantee a pain-free existence, but we can definitely guarantee better quality of life through better movement and less pain. That is inevitable when you take the mechanical stress and minimize it at that joint. Now, remember, if you've been dealing with higher levels of pain and pain for a longer period of time, that process takes more time. You have to be a little bit more patient. but the process is not particularly complex. It just requires consistency to get those results. And if you choose to go that route after doing that screen, more power to you. So thank you, folks. I appreciate so much you spending a little time with us here tonight. Let's see, I had something here. Let's see. Okay. Okay, excellent. Great. Glad you're joining me. Thanks for that information. If you have people that deal with this issue, please do. And I appreciate you sharing that information with anyone that can benefit from it. Hopefully we can align together and help a lot of people who've unfortunately spent a lot of money trying to find solutions that don't get to the root of the problem. So that's great. And I mean it, you've got my information at any point, even if it's not, tomorrow, the next day, maybe it's a month or a year from now. If you have questions about knee pain or any other mechanical issue, mechanical musculoskeletal problem, I want to be a resource. So don't hesitate to reach out. I'd love to answer any of your questions at any time. So take care. Blessings to you all. Look forward to spring. Take care.